I'm Dr. Mike Milligan. We have Dr. Brad Bale and Amy Doneen here, developed the Arteriology course for dentists. Brad and Amy, tell us a little bit about that course and who did you develop it for and why did you develop it?
Yeah, we developed it mainly for the dental profession. We also wanted physicians to attend as well to start building partnerships in communities between dentists and medical providers, because we now have level A evidence that periodontal disease is independently associated with cardiovascular risk.
Right.
And that type of evidence is extremely hard to accumulate. Our guidelines in medicine, less than 20% of them are based on that level of evidence. That's as great an evidence level as you can attain. And then to throw in independent is extremely significant. That means they adjust for how far did you go in school, what's your income, what's your cholesterol, your blood pressure, how much do you weigh, and when they do that, most everything falls off the radar screen as an independent association. But periodontal disease remained independently associated, level A evidence with cardiovascular disease. So there really is no scientific question any longer about that. Periodontal disease does create cardiovascular risk. It is associated with heart attack and stroke.
What about apical disease, endodontic disease, decay causing an apical infection with the tooth?
Yeah, there was a very exciting study that was just actually published in print about 2 months ago in Circulation, an American Heart Association journal, that talked about the endodontic connection as well as a periodontal connection, where they took 101 people actually having a heart attack, and they were able to aspirate out the culprit blood clot that was causing the obstruction to the flow, and at the same time they aspirated out arterial blood, and they analyzed those samples with DNA for oral pathogens. The first thing they found, there was a 16-fold higher concentration in the clot that came out of the wall of the artery than in the arterial blood. So that tells you that these germs that were found, they were inside the wall of the artery at the time of the heart attack, and they came out into the clot that blocked the flow of blood. And they found 78% of the clots had the oral pathogens responsible for endodontic disease, the strep pathogens, and 35% had the periodontal disease pathogens.
My goodness. So is there any information on the percentage of heart attack, strokes that might be that oral bacteria might be involved with as a potentially causative factor?
Yeah, well, in that same study, they took 30 of the 101 patients having a heart attack, and in those patients they also did panoramic CT x-rays, and they found periapical abscesses in about half of those cases. And if the patient had the pathogens in their clot that cause endodontic disease, there was a 13-fold increased risk that they would have a periapical abscess. So from that study, one could draw a conclusion that perhaps somewhere around half of the acute heart attacks may be triggered by oral infection.
That's huge.
That is huge.
Up to half of heart attacks, acute heart attacks, could be caused by oral infection.
Correct.
That's correct.
Wow.
And clinically, it fits with what we see.
Okay. Clinically, that fits with what you see.
Amy and I prevent heart attacks, but by doing that, we also see patients who've just had heart attacks.
Right.
And we both have cases now since that was published. Actually, every case I can think of where I've seen a patient within a few months of the time they had their heart attack, we've uncovered unsuspected periapical abscesses which have required extraction of the tooth.
My goodness. Okay, so that being said, this is huge.
It is
that
huge.
Dentistry be involved with this. what subjects are covered in this course, and what would a graduate of this course come away with?
So part of what we wanted to do in this course is to start to articulate this data so that it's understood by both communities in a way for which they can start to form communication lines and start to talk to each other in a common language.
The medical and the dental community.
Yeah, the medical and the dental community. So people in medicine seem to be isolated, and people in dentistry seem to be isolated, and yet there's a core need that if we want to really shut down heart attacks and improve vascular wellness, then these two large bodies of scientific organizations need to start communicating with one another. So our drive in the course was to create a pulse of energy, if you will, to start formulating that common language of communication. One, being able to articulate the data so that people in dentistry knew how people in medicine thought about periodontal pathogens and endodontic pathogens, and then also to let the dental community understand how in medicine we look at the human body from an arterial wall standpoint, and what we are looking for to forge those communications. So the course really was to talk about the science, but also to begin that bridge of communication so that we can talk to one another for the benefit of the patient ultimately.
Absolutely, for the benefit of the patient, working together. Anything else that you'd like to say about this course before we have them watching it?
Well, one thing that I would like to say is that since we've been on this journey for the last several years, what is very exciting is that the data as it's being published, and it's dynamic, it keeps building upon itself to the point that we think, wow, there's a new piece of literature such as these endodontic pathogens, the streptococci that we now know is present in acute MI, and almost, as Brad mentioned, 50% of acute MIs we could possibly blame on these occult infections. That's a tremendous missed opportunity in medicine that they're not recognizing the endodontic connection. But as the data continues to present itself, we need to find a venue for which we can roll that data in and garner an understanding how we're going to bring it to clinical practice.
Wonderful. So we talk about the science, we talk about, in these videos, you talk about the implementation, you talk about what to look for, who to screen, who to refer. It's all right there. How to refer, it's all right there in that course.
Correct.
Yes, it's very comprehensive.
Yes, it is.
And as Amy says, as the data continues to come in, it just supports what we presented in that course, which is
wonderful.
Not a year old yet.
Well,
so we don't have to worry about going to bed and tomorrow morning, oh my gosh, they published a study saying this isn't true. No, it's solid.
It's solid. It's solid. Well, thank you for creating that course, and we're sure anxious for many of the dentists and physicians to take this course, learn, work together to help the overall health of the patient. Amy,
Excellent.
thank you so much.
Thank you. Thank you.
Thank you, Mike.
Thank you
Appreciate
very
it.
much.
Thank you.
Yeah.